I think as a physician and prior service at the FDA make you an excellent choice to lead the agency. We talked in my office, or to be more accurate, I talked, we listened. I'm confident in your commitment to public health and putting patients first in decision making. I'm going to vote for you, and I'm not going to ask you a yes or no question. I'm chairman of the Agriculture Committee as well as a member of this committee. I am particularly interested in your thoughts on the FDA's role in ensuring food safety. Under the previous administration, it is my opinion that we saw increased activity and regulation actions on nutrition policies, such as issuing voluntary guidance, yet at the same time requesting additional money to comply with statutory requirements under the Food Safety Modernization Act. The acronym for that, by the way, is FSMA, which I find somewhat unique. I have concerns that the agency has not prioritized the FDA's mission to protect our nation's food supply and instead focused on nutrition policies. How will you focus on core FDA duties such as implementing the law that Congress passed rather than agenda-driven nutrition policy guidance as we saw with sodium and added sugars?
Well, I can. Thanks for the question, Senator. This is an agency that has a statute that's been amended over 100 times since 1938 and has a vast scope of responsibilities. And I think we do need to focus on core mission and make sure we're achieving what Congress intended in terms of protecting and promoting the public health. I think FSMA was a significant advance in terms of giving the agency the authorities it needed and the resources it needed to ensure the food supply is safe. And my mandate is going to be to make sure FSMA is implemented in a proper way and that we're striking the right balance with respect to that implementation.
Last year in the Ag Committee, we worked a whole year and were finally successful in passing the biotech labeling bill, which the department will be working to implement in the next couple of years. At the same time, FDA has been working to update the Nutrition Facts Panel, which is set to go into effect next summer. There's a great deal of concern that the FDA has not provided the guidance necessary for compliance. This includes guidance for dietary fibers, which we discussed previously when you were in my office. In addition, hundreds of millions of dollars could be lost due to lack of coordination between the Department of Agriculture and the Food and Drug Administration on these label change timelines. Will you please work to ensure proper guidance is available and consider postponing the current deadline for the Nutrition Facts Panel to help reduce regulatory burdens?
Well, Senator, this is something I'd certainly be delighted to work with you on if I was confirmed into this role. I'm philosophically in favor of trying to make sure that we do these things efficiently, not only because it imposes undue costs on the manufacturers if they're constantly updating their labels, but we also have to keep in mind it does create confusion for consumers that the labels are constantly changing. So you want to try to consolidate the label changes when you're making label changes as a matter of public health, so the information is conveyed accurately and efficiently to the consumers. So this is something that I do care about, and I look forward to working on if I'm confirmed.
I appreciate that. Mr. Chairman, I have further questions. I will submit them for the record. Thank you very much.